Depression, Marcia, is a big thing in the UK.
It is.
Tell us about depression.
I think, historically, men do not go to the GP. You have to force them, literally pluck them up and make them go to the GP. A lot of the time, it goes back also to the fact that men are supposed to be strong. Men, deal with stuff. It's that kind of thing. It's not something that they're going to want to talk about.
Right.
It's something that we have to change the narrative about that. We all get vulnerable at times, and we all need that help and support. But I think this, the system that we've grown up in is that kind of patriarchy where men are meant to be strong, men need to pull themselves together. That kind of attitude is still there, so they're less likely to go to see the GP. But talking about narcissism, and I think it's important to say that, because now it's like a popular term. Everybody's talking about narcissists and narcissism. All of us are on the spectrum to some degree or other.
Mm-hmm.
All of us will have some narcissistic tendencies. Some of us. So it's normal. Where you have the problem is where somebody has narcissistic personality disorder, and that's the difference. Okay, so we're talking about somebody who it is part of the mental. It's on the American Psychiatric Diagnosis of Mental Health Disorders, the
Right.
DSM, and it is classified. It comes under what you call
Marcia, Marcia Hylton. Let me go through your bio.
okay.
Because I want the people to understand who I am speaking with, and a little bit about Marcia. But before I go into anything at all, I like to start my podcast with a word of prayer. As I always mention, my mom was a praying woman, and the reason why I've started this podcast from in the first place, because I never knew I could do this. So the reason why I started this podcast from in the first place is because I lost my mom to cancer. And obviously she was a praying woman. So I have to make sure that the fact that I started this podcast because of her, and she was a praying woman, why not start with a word of prayer? However, I like to give my guests the honors to speak, to pray. So would you care to pray for us tonight?
Sure, I'll pray. Okay, Heavenly Father, we just give you thanks and praise. We give you all the glory. Thank you for this platform. We thank you for Brian. We thank you for the Ivy Cancer podcast. We pray, Father, that you will bless this time of sharing, and that everybody who will be listening will gain something from it, Lord, that they will know your peace and your joy. In Jesus' name, amen.
Amen. Amen. Marcia Hylton is a certified international coach specializing in recovery and emotional reliance after a narcissistic abuse and a toxic relationship. Marcia is also an advanced medical practitioner with over 25 years of clinical experience. She's a qualified nurse and qualified physician associate. The first Black woman, let's highlight that. She's the first Black woman to train as a physician and associate in the UK, where she practiced medicine in the field of trauma and orthopedic, vascular surgery, and more recently, hematology. Marcia has lived an experience of navigating her way through the mental health system, though through being a carer of her son with a mental illness. Working in healthcare and education industry as a lecturer has been and continued to be her passion. Currently following early retirement, Marcia is now a transformational coach promoting holistic health and special interest in women, mental and emotional health through trauma recovery coaching and community education. Welcome, Marcia, where we discuss cancer, health, lifestyle, and healing. Welcome to the Ivy Cancer Podcast.
Thank you so much. Thank you so much, Brian. It's such an honor to be here, and I'm really, really excited to be here today with you. So
I am
thank you for
I am
inviting me.
I am really happy that you are here. We discuss a lot about mental health.
We did.
I'm so excited to share with my platform. And so, mental health is, I didn't know was such a broad umbrella.
Mhm.
And under mental health, we have mixed anxiety, depression, and it says that 8 in 100 person have been diagnosed with anxiety and mixed depression, general anxiety disorder, post-traumatic stress disorder, obese, compulsive disorder, panic disorder, and depression. And depression, Marcia, is a big thing in the UK.
It is.
Tell us about depression.
Well, sometimes with depression, it can just creep up on you, and you have no idea actually that you are depressed. I certainly have been, and
Yeah,
I have had to have medication for my depression. I
right,
think it's something that's not really talked about. I
right.
think people that with depression, there's this whole thing around because there's a lack of understanding, or at least there was. I think there's more being talked about it now, but I think the attached to that is this kind of shame that nobody
Mhm.
really wants to talk about depression. Sometimes we don't recognize that, some of us are in a place of depression. And I think, I suspect that a lot of us will at some point in our lives have experienced it, maybe not have had it treated, but it's devastating.
Right,
It's very devastating when it happens to you, and it's very hard to get out of it without help and support.
right. They said one in 5 person in the UK have suicidal thoughts
Mm,
because of depression.
yeah.
And I think that, and many of them act on that.
Mm.
Why do you think they act on their thoughts when thinking about suicides?
I think, I mean, and this is very subjective. It's really my thoughts. I think when somebody is at that place where they're thinking of acting, having these suicidal ideations, these suicidal thoughts, there are there's no hope. Hope isn't there anymore. And through my work in the medical profession, one of the things that I would say, most of the clients or the patients that I've had fight for their life,
Right,
fight right to the last breath. They will fight to live.
right,
So when somebody is in that place where they no longer have hope, where they're thinking of taking their life, and some actually go ahead with it, you
mm-hmm.
know that they're in a place that is unbearable for them. And we who maybe, I've not had suicidal thoughts, but I have thought, well, what if it doesn't matter? Does it really matter if I'm not here?
Right.
But I've not thought about harming myself. But if people have got to that place where they're feeling they're wanting to do that, that there is no hope. And without hope, what is life?
So they lost a sense of hope.
It's the hope that things could get better. If you've got no hope, what is there to live for?
I myself been diagnosed with severe depression and anxiety in 2020.
Mm-hmm.
And I was at a place where it's only God took me out
Yeah.
because, I was thinking so much, and I realized, why some people may act on their feelings. Because as you said, there's a sense of there's no hope. There were some times that I feel like I don't want to get out my bed. I don't want to go to work. I don't want to speak to anyone. I don't want to be in anyone's space. I just want to be in my space.
Yeah.
What do you think really was happening to me at that given point?
I think with mental health, you're not in your right mind, even when you're in a state of depression,
Right.
because you think that nobody's going to be able to help you. It's a feeling of isolation. It's a feeling of being on your own. There's a feeling of being alone, even if people are around you. For me, there's a difference between being lonely and feeling alone.
Right.
And I think sometimes when we're in that space, we feel alone.
Yeah.
There is nobody around that will be able to help us out of this situation that we find ourselves in. Remember also that with depression, there's also a chemical imbalance. So it's not necessarily always about your feelings. There's a physiological thing that is going on with us in our brains as well. So it's twofold. And that's why we take medication to lift the melatonin that actually helps to balance our mood. So our moods are very low. And sometimes we need that boost through medication to kind of lift that for us. So it's the physiological aspect as well as the mood.
Right.
As well. Yeah.
Right. You know, I was told by, Dr. Amanda, because I had an interview with her before, and she had expressed to us that, anxiety is something that you're worried about in the future, that will happen in the future. And depression is something that you're worried about, that's in the past. But what advice would you give someone that's been struggling with depression?
I think the thing is to actually reach out. A lot of the times we don't want to reach out.
Right.
I mean, I think it's somebody. There's a few things that I found, and I particularly drawing on the experience that I had myself, particularly with one of my sons, who had a diagnosis actually of schizophrenia.
Yeah.
And I remember, but I didn't know, even though I was a medical professional, I knew something wasn't right, but I didn't know what it was. And I remember he went through a period of depression. It was very bad. And I remember he had a diagnosis of being clinically depressed. And then what they said was try and eat. So it's practical things like making sure that you eat a balanced diet. But it's really hard to do that when you're not in a good space anyway. But some of the things that I would say is to make yourself eat as balanced a diet as you can do. Get outside into nature, into the outside of the home if you can. Try and do things as normally as you possibly can, and seek help. I think first and foremost, get help. Go see your GP. Speak to somebody that you trust. And so those practical things will be able to kind of start you on the journey. And I'm not saying that it's easy, because it's not. It's a hard thing to do.
Yeah, because many of us do not want to seek help.
Yeah.
How would that work for people like us who really do not want to seek help? Like, what advice would you really give to them? Because as you said earlier, it's a sense of hopelessness. Right? Many of us do not want to seek any help. For me, like, I think I lost hope in the system, because when I went at the first time when I went to seek help, I actually wanted help, because I was thinking, and I won't put it on the air, I was thinking ways that I never thought I would think. Right? So I reach out and I seek help. And I seek help twice. And the therapist that was giving me the session, I had 6 sessions, but at the end of the 6th session, he said to me, they can't help me, because what I'm going through, it's basically self-inflicted. I can basically change that. And when I heard that, I was like, huh?
That doesn't sound right to me. And I think sometimes what I would say to people is, if they've had an experience like you have had, seek somebody else out. And I know that with therapy, with counseling, usually it is about 6 sessions that you will have.
Right.
And then they kind of move you on. And I think that's because of the waiting list that they have. But what I would suggest is seek out a psychotherapist. you know. So, and actually the person that you were with should have signposted you to other places where you could have got help. So it would seem to me that you know, there was something missing there for you.
Yeah.
Once you've finished your 6 sessions and you still want to go on further, they, you know, that counsellor should have been able to signpost you somewhere else to continue the therapy, you know, the talking therapies, which, you know, which would have helped. So there's for me, there's something slightly wrong about what you've just said. That shouldn't have happened, in my opinion. You should have been able to. We don't leave people in limbo. If somebody has come to you for help, and after 6 weeks, it's not, oh, okay, right, your 6 weeks are up, bye bye. That's not how it should be. But I know that that's the experience for a lot of people. And really, you should have been signposted. Now, there are other organisations that, you know, we can tap into that will support. I don't know what your situation was when you left after the 6 weeks, but there are, you know, there's people like myself who are coaches who specialise in anxiety, and you can go on for, you know, for longer periods of time. But not only will they help you to deal with the situation that you're in, but what we'll also do is find out actually, you know, where you want to be. And that's the whole thing around coaching. It's where do you want to be after, you know, you've had the sessions, and we help you to plan where you want to go, and just take it in bite-sized steps, because there's no quick fix. You know, everybody heals at different paces. You know, there's no kind of, right, after 6 weeks you should be all right. There's none of that.
Right.
And that shouldn't be, you know, that shouldn't have been something that you were told, you know, sorry, I can't help you, move on. That to me is wrong.
That is one of the things that I realized with the UK. I'm not certain about anywhere else in the world. I can probably speak for Jamaica, because for me, Jamaica have a poor health care system, you know, but you could probably expect it because it's a third world country. But if I'm living here in the UK, and I think that, you know, because of the overload of patients, right, they tend to just see you quick and fast, and just like, even in the GP, like you go to the doctor, like they literally give you 15 minutes, just speak what you're going through, right? Where that isn't concerned in Jamaica, if I go to my doctor in Jamaica, it's like, I would say probably about 70%, 80% of the people in Jamaica go to a private hospital, a private doctor.
Yeah.
Right? So I'm used to going to a private doctor and expressing what happened to me, what am I feeling, and the doctor examine me, tell me what's the possible cause, put me, after diagnose me, then they put me on a series of medicine. With the doctors here, they just basically, you can't, and if I have more than one complaint, I could express myself to the doctor in Jamaica. The doctor here in the UK, if I have more than one complaint, I have to rebook my next appointment.
Yeah.
Even if I'm suffering with both conditions, I have to rebook. And I think that is something that the doctors, the government here in the UK should literally address, because people are suffering. Because I went to the doctor for 2 symptoms that I was feeling before on more than one occasion. And because I call in for one particular thing, the doctor said to me, oh, you have to rebook and come see us again. I was like, what? I'm already here. I would have to book time off again from work.
Yeah.
You know what I mean? So when it relates to, you know, as you said, you mentioned that therapist should, you know, refer me to someone else. I agree, because I would say that they can't, you know, carry on with the task.
Absolutely. I think what you said is absolutely true. That is one of the reasons why my role exists, because the NHS, especially in primary care and GP land, it's very is very, very saturated. They don't have the capacity to give you the time. They
Right.
just don't have the capacity. So they will utilize nurse practitioners. They will utilize people like myself who are physician associates. So we're trained in the medical model, so we can offload some of that stuff. So what they should be really doing is referring you, if they don't have the time, they should be referring you to somebody else, such as the advanced nurse practitioner or a physician associate. Yeah, you shouldn't have to. And the thing is, as well, the other thing about that as well is, if you ring up in the morning, you have to. It's almost like it's a race to get to the phone to
Right.
8 o'clock
Right.
to get an appointment as well.
Right. Right.
All of these things are really impacting.
And after time you call, even when it open at 8:30,
You can't get.
after time you call, you're in a queue.
Yeah.
You're in a queue of probably 35 people. And you've
Right.
been on the phone waiting for like an hour.
Yeah.
And then when you get to the phone call, finally at 1, we are fully booked. You have to call back.
Yeah, it's bad. It is really bad.
It is.
And this is why there are lots of we have to, I am a firm believer in that we as a community have to start to take our own health in hand. So for example, there are community interest companies that are now setting up, because we have to look after our own, in the sense that we have to be doing. So there's a lot of organizations, voluntary organizations, community organizations that are picking up some of that slack now. And so some of the the hospitals and the GP practices are referring, they call it social prescribing. And so a lot of, particularly around mental health, so a lot of people are being signposted to these places, which is what I was saying earlier for you, that you should really have been signposted in terms of your mental health, in terms of, the clinical aspect, like if you're coming with a physical illness, you're coming with your symptoms, really and truly, there should be something else in place for you. If the doctors don't have the time, go and see a physician associate who can spend more time. When I was having my clients, my patients, I would have more time. I'd have more time to spend with them, and it takes some of the pressure off GP practices. The problem that we've got with my role as a physician assistant or as a physician associate in the UK here, in spite of the fact that I qualified in 2010, and there was a handful of us then, I was the first Black, Caribbean person that trained at that time. I was part of the very first cohort to train in this country, in the university to train. Now, fast forward, there's a good few thousand of us, and yet very few people have still heard of physician associates here in the UK. And there has been a bit of pushback about us as well, because in spite of the fact that there's, we've got a crisis in the NHS, there's still, the medical profession are still not happy about us being here, because we're taking their jobs, we're doing this or we're doing that. And it's the same when I was a nurse, when they started to introduce advanced nurse practitioners, there was pushback, because they felt like, well, we don't have the same training, as the doctors. But actually, we are needed. We are needed. Now you can go to the pharmacy and get treated for very minor ailments. So what they're saying is, go to your pharmacist if you've got a sore throat, or you've got an itch, or something like that. So normally you would have gone to your GP with those things. Now they're saying you need to go to the pharmacist. They won't even see you now in GP practice.
That's sad.
It
That
is.
is sad.
It is.
That is sad.
It is.
I can remember at one point I had to go to the boots walking to see the practitioner there. I couldn't get any spot into. I was suffering with a toothache.
Yes.
At the time, and I couldn't get any appointment from the GP. So they referred me to go to the boots walking. So I know that for a fact, and it's sad. There's a statistics shows that more women report anxiety and depression than men. but men are more likely to commit, suicide. What's happening there? What you think?
I think historically men, historically men do not go to the GP. You have to force them, literally pluck them up and make them go to the GP. A lot of the time it goes back also to the fact that, men are supposed to be strong. Men, deal with stuff. It's that kind of thing. It's not something that they're going to want to talk about.
Right.
It's something that, we have to change the narrative about that. We all get vulnerable at times and we all need that help and support. But I think this, the system that we've grown up in is that kind of patriarchy where men are meant to be strong, men need to pull themselves together. That kind of attitude is still there. So they're less likely to go to see the GP. They're less, if they're feeling down, it's like, just suck it up and just move on. But, if we don't, look after our mental health, we will suffer. But we're not. The society that we're in right now, things are starting to change now. It's been recognized that more men need the help. There are lots of men's groups, and particularly in the Black community as well.
Right.
I think there's that recognition that men need support also. So there are lots of things that are, certainly in my community, there's lots of things that are starting to spring up, and that recognition that men's mental health is, we need to be really looking at that. It's a real problem. So, yeah.
You think men need to, forget about the stigma where men should be strong, men should be mature? You think men should put that aside? Because I think that is one of the things, even with their own health, like physical health, with even prostate, a lot of the men got late diagnosis with prostate because they're afraid to go to the doctor.
My father,
with especially men in Jamaica, because they're so homophobic, and because of the past test. Because you have more improved tests now.
Now it's just a blood test. Yeah.
Right. So and a lot of them is not educated with that. They just have this thing in their head. Oh, me no make no man do this, or me no make nobody do this. They're so blinded that they get late diagnosis. And it's the same thing with depression. They're not educated enough with their self. And it don't have to be educated as in education, it's knowledge.
Yeah.
You know what I mean?
Knowledge, yeah.
So you need to know about these things. Just push past the stigma, because if I followed the stigma that I grew up on, I wouldn't have seek help.
Yeah.
And where would I be today?
Exactly.
You know what I mean?
My father was exactly that. When he came from Jamaica to this country, and I'm sure a lot of people can relate, he worked hard. He was part of, my parents are part of the Windrush generation. So they came here, they worked hard. And then when he did take sick, it was too late, because he already had the symptoms for a long, long time, but never spoke.
Right.
Never spoke up.
Right.
And it was only when my mom noticed that, every time she put, the painkillers in the house, they were just disappearing. She went to work, forgot something, came back and found my dad vomiting. And by the time we got into the hospital, got the test, he was too far gone. His prognosis was terminal. Right. Because he left it late. He didn't go to the doctor when he had symptoms, and he was hiding them.
Right.
He hid the symptoms because, again, it's, the strong, Black man, I've got to look after my family, blah, blah, blah. And, those kind of things. Right. And to his own detriment, right. And I think it is, you're absolutely right. I think it is about education. It is about that knowledge, right. Not from an academic point of view, but just knowing your own body, learning to know what your own body is,
right.
What the symptoms are, what's normal for you, and know what, when it isn't, you seek help. And that there's no shame around going to find out what's happening with your own body. Yeah.
Casey, I mentioned that a programming from childhood. It's not that easy. What are your comments on that?
She's absolutely right. It isn't easy because we do have a lot of programming, you
Right.
know, and it's about having that self-awareness to know actually, you know, we have to unlearn some of these things that we've been taught, what we've learned over the years. And a lot of
Right.
the time as well, there's a lot of trauma around that as well.
Right.
It is, we do have to unlearn a lot of the programming, but we have to be aware that we need to change until we actually at that point where actually I need to, and you know, I want the help, but something
Right.
within me has to change. Otherwise, it won't. But it's also about education. It's about other people bringing that information as well. And I think it's a community effort that we need to work together to raise awareness. It's about awareness raising. And
Right.
that's when people get the information and we can start to work with people, you know, whether that's through going to see, you know, a professional or go coaching or psychotherapy and unpack a lot of those things. Yeah, so I'm just saying, you know, I think it's awareness raising. There's
Right.
a lot of, you know, awareness raising that needs to be done, so that people get the information. You know, sometimes I've heard it referred to as, you know, hard to reach communities, especially us as Black people, that we're hard to reach. It isn't that we're hard to reach. It's just that the information they need, you know, the organizations like the NHS need to be bringing that to us. It's not that we're hard to reach. You know, they need to bring it to us. They
Right.
need, you know, they need to find ways in which we can, you know, access services as well. You know,
Right.
and you know, and within all of that, it's about, you know, awareness raising as well. So I think there's it's not just one thing. I think it's lots of different things that need to come together.
Right. Um, PTSD.
Yeah. Okay.
I want you to touch that a little bit because that as well, you know, it's obvious in your bio, and that as well is something that, you know, a lot of people been diagnosed with, even though the statistic that I have here is just stating that 4 in 100 people, but I'm certain that there's more people than that been diagnosed, and this is like a day today's statistic. Can you give
Mm.
us some knowledge on that PTSD?
Well, I'm gonna have to tell you, you know, even though my thing is I help in terms of mental health, my
Mm-hmm.
thing is around healing. So
Right.
PTSD is not my, you know, it's not necessarily my area. But
It's
what
not.
I would say is that um a lot of us are suffering from PTSD and we don't even know.
Definitely.
So the statistics that you've just quoted is probably a lot higher.
Yeah.
You know, it's probably a lot higher than that. And again, I think if we, you know, and a lot of us, you know, if we, because PTSD is it's around trauma, okay?
Mm-hmm.
So when we think of trauma, you know, mostly as a big event. So it's something like, I don't know, a car accident or, you know, an explosion, something big that everybody can see and see
Right.
that this is, and people, you know, you're in, you know, you're in the army, you know, you see horrible things, PTSD,
Mm-hmm.
okay? So, and so lots of things will be triggering that. But then you have, so that's what I would call a big T trauma. So that's a big T trauma. Everybody can see that that's a major event that's happened. You also have little T traumas. Okay. So these are the everyday things that happen
Mm-hmm.
in our everyday lives that
Right.
might be happening over and over again. So it'll be things like, and people don't necessarily recognize this as PTSD, but
Right.
you know, if you've been, you know, emotionally abused in your home, you know, you're getting put down, you know, little things like told that you're stupid, and all of these things,
Mm-hmm.
um, domestic abuse, you know, things like that all add up. So you get this drip, drip, drip of
Right.
everyday traumas, little T traumas that over a period of time will build up and will have the same impact emotionally on somebody as a big T trauma, if that
Right.
makes sense. So, and
Right.
people can get PTSD from everyday things that happen. There's such a thing as adverse childhood experiences. So
Right.
even as children, these things will build up over a period of time, and we can get PTSD. Sometimes it's called complex PTSD, you know. And so, yes, there's a lot of therapy and, working through a lot of that to lead us towards healing. It's now recognized that particularly with children, we have to be, because these children grow up to be adults, and then it's reflected in the behaviors that we have when we're big people. And so we have to recognize, particularly when you're trying to access services like NHS.
Right.
And if I gave an example, you get somebody come to reception and they can't get an appointment because, when they ring up, they're like number 50 in the queue, and then they rock up to the surgery because they're in pain or something has happened, and then they start shouting at the receptionist, and they're all looking at them saying, "What has happened to this? What is wrong with this person?"
Right.
And then they get banned from the surgery. There will have been something that's not just the physical ailment that they have, but we should be looking at what has happened, not what is wrong with that person, but what has happened to this person that has brought them to the surgery and that they're angry. And so we all, I think, have a responsibility to know what it is to be, particularly when we're in those places of working with the community, as a professional. We need to be trauma informed and know that when somebody walks through your surgery door or in your workplace and they're behaving in a particular way, it could be that it's PTSD, it could be some form of trauma that you don't recognize. And so we have to understand, and that then makes us more compassionate in how we deal with people. In terms of going back to your point about PTSD and what to do about that, what I would suggest, because it's not my area of expertise, PTSD, but what I would suggest is that we recognize that something isn't quite right, and it's about signposting people to places where they can get the support. It's about when you connect with somebody, speak to them. We need to be able to communicate. We need to also know how to listen and to be able to pick up when people are saying and recognize that actually this person might be a little bit distressed, and we can help them. And it can be anybody. It doesn't have to be a professional person. You could have a conversation with somebody in the street, and just by listening, you've given them that space. You're holding space for somebody to be able to talk, and you can pick up, and you might be able to signpost them to other places.
Right.
As I said, it's not my area of expertise. Yeah.
So how I come to know you was a health seminar kept by Hylton Scar or Scar,
yeah.
right? Hosted by Joanna. And you were talking about your situation, your experience, mental health. And you mentioned that your son earlier, that, that's how it started.
Yeah.
Would you give us a little snaps of that experience? And if so, is that the reason that led you to practice mental health therapy?
Okay, right. So my work in the mental health realm is really about recovery, emotional recovery. Okay.
Right.
So starting with my son, he was 15,
Mm-hmm.
and I got a phone call from school. I noticed certain behaviors, but I didn't really put it down too much. I just thought he was 15. And then up until that point, he was a good kid. And then I noticed certain behaviors, and I was thinking, oh gosh, this bad behavior is kicking in late, But anyway, he was 15. I got a phone call from the school to say that he cut his hand and they were going to take him to hospital. And I remember thinking, okay, so he's cut his hand. They've called an ambulance to take him to the hospital. And I remember thinking, that's odd if he's just cut his hand. Why call an ambulance? But I said, okay, I'll meet you down at A&E. So I left work, went to A&E. When I went there, he was sat in A&E with a big wad of cotton wool around his hand. And the registrar who was in A&E at the time unraveled it. When he took off the cotton wool, my son's hand from here was split all the way down here, and it just fell open.
Wow.
And it just parted like that. And I felt sick to myself. I nearly vomit because I didn't know what happened to my son. What he'd done is he'd punched a window in
Wow.
school, and as he pulled his hand back, the glass just cut him, sliced his hand. He had to go to surgery that day to save the use of his hand. You know, I have to give thanks that his hand is now all right. But that was the beginning. That was the beginning of him, showing signs of a serious mental health problem. It got worse. We talked about depression. He wouldn't come out of his room. He was always a bit OCD anyway. So he wouldn't come out of his room. He wouldn't draw the curtains. Normally, sometimes when people, the normal thing is when people are depressed, they probably don't wash, the hygiene's probably suffered a little bit. He was the opposite. So, and he was always a little bit OCD anyway, but that was heightened. So he was every minute he was in the bath, and I was even starting to wonder if somebody doing something because he's just in there scrubbing and till all his skin was peeling. But then he'd go back to his room. He wouldn't get out. I tried to get people to help. An organisation came in on a recommendation who did an assessment and said he was clinically depressed. Oh, and just let him eat, give him a balanced diet and get him some exercise. And I'm thinking, I can't even get him out of bed.
Much less.
You know? And so in the end, I managed to get him to my GP and I begged them, I said, you have to do something. So they gave him antidepressants. The antidepressant lifted the lid. He just went crazy.
So the antidepressant make it worse?
It made it worse because now he was trashing my house, punching holes in walls through doors. I was having to replace furniture, replace doors. My youngest son was terrified because he was like, wow, what's happened to my brother? And they were very close. All of a sudden, this person was a complete stranger. Who is this? This is not my brother. And then I had to get my son the youngest one, I had to give him to my sister for him to stay there for a little bit because he was scared. And by this time now, my son, the one with the mental health issue, was burning his clothes on the cooker, saying there were demons in his clothes. So I couldn't sleep. I had to stay awake in case it burned down my house. The catalyst came when one evening he was raging, just raging and swearing. I mean, he was so totally out of character because this was not who he was. And so he was swearing, he'd come up in my face and swearing, and I did not know what to do. And I remember picking up my Bible. Honestly, Brian, I just followed him around the house, just reading random Psalms, just read the Psalms, and he's punching this and broken up that, and I'm just reading the Psalms. Then he'd come up into my face, close up, swearing, and I'm looking at him and I'm just reading the Psalms. And then he would just switch and I remember him sitting on the stairs and he's looking at me. And at that moment, there was some he was normal. And his eyes were like looking at me saying, Mom, help me, Mom. And my heart bled. And then it would just switch again and the rage would just come in. And I knew then he needed help and I did not know how to do it. And now this had been building up over weeks, and I was tired and I didn't know what to do. And I remember I just continued reading the Psalms and eventually he calmed down. He laid down in front of the fire and I thought he was asleep. So I stopped reading. And then he lifted up his head and he says, I said to him, are you tired? And he said, yeah. And I said, go to bed. He went to bed and he slept for the first time in weeks. He slept. But I never slept. And I remember pacing my bedroom floor the whole night saying, God, I can't do this anymore. Please, you need to help me because I can't deal. I don't know what to do. I don't know what to do. You have to help me. The very next day, it got bad again and I had to take him to the hospital. And when I got to the hospital, because I used to lecture at one of the medical schools here in Yorkshire, And the professor, the head of the medical school, he was a consultant, but I didn't realize that he was a young person's psychiatric consultant. And he happened to be on call that night when I got into the hospital. I didn't know whether to be ashamed, whether to be embarrassed, or whether to be just happy that it was him, you know. And he did the assessments, and and I'm watching my son not recognizing who this was. And he said to me, Marcia, we're going to section him. We're going to section him for 28 days so that we can assess and see what's happening with him. And I was like, no, please don't. And he says, it's out of your hands. We are going to section him. And part of me, I'm not going to lie, part of me was relieved, because I thought, right, now he's going to get the help he needs. And I could get some rest. The whole of the weeks, it was probably about 8 weeks or something that this was going on. And I remember having to leave him at the hospital. He wouldn't stay. They admitted him onto an adult ward because they had no beds in the young people's section. So there he was on this male ward, pure, men, big grown men. And he said to me, I'm not staying.
How old was he at the time? Still 15?
He was 15,
right.
Yeah. And it was, I'm not staying here, he says. And so I stayed with him as long as I could. But when I was leaving, he tried to follow me out of the hospital, and they had to hold him down. That broke my heart. It took off the hospital door. The strength that he had, it took 3 of them.
At 15?
At 15.
Whoa.
Yeah.
Whoa.
And that was the start of it for me. Yeah.
So was you in mental health all along?
No.
So was this the cause that led you to mental health?
Because even though I was a health professional, mental health wasn't something that I was that interested in, to be fair.
Right.
So I didn't really know that much. And even I knew something was wrong.
Right.
By his behavior, particularly right towards the end before he got sectioned. But I didn't have that much. That wasn't my area, so it wasn't my specialism at all. So my involvement in mental health was really around supporting others to navigate through the mental health services, because that in itself was another battle again. So the medication, for example, blew him up like a balloon till all his tongue was hanging out of his mouth. I had to be strong and tell them, stop that, change it to something else. And just manage. And even, after he came out and we're trying to manage everything, I always knew when something was happening for him. So, as his carer, praise the Lord, he's so much better now. It took a lot of years, but he's at that place where he's good. He's good now.
Right.
But it was, when they're about to go into crisis, because you see the signs, you see the build up to it. And I'm thinking, this is where I now need the help, because I don't want it escalating to the point where he needs sectioning.
Right.
But there's nothing in place. So you see the signs, nothing in between except section at this end. So you got the signs, you got the section, but nothing in between. When I tried to get help for him, he's got capacity, meaning that he's able, he can speak to him, and he can tell you what he wants and what he doesn't want. So he's not delusional or anything like that.
Right.
So they won't do anything. They do nothing until it get to the point where he's gonna have to go back into hospital. And for me, that was really hard, and that's what I was advocating for something in the middle bit. We don't want him in hospital. Give him the help early so that he doesn't have to be sectioned. And that's the issue. So there's something around having things in that middle bit, So that was where, and not only that, there were so many people, especially in our community, that were suffering the same thing, but nobody was talking.
Right.
Nobody was talking. Families suffering in silence. So I was never ashamed to speak about it because it is what it is.
Right.
We need help. And it was only through talking that people say, oh, actually, that happened to my daughter, or that happened, I'm going through this right now.
That
And,
that is
so,
definitely true, because that's
yeah.
what I realize now since I start this podcast. You know, a lot of people do not want to speak their experience.
Yeah.
But until some of them speak their experience, they can spread more awareness, because a lot of people do not know what's going on.
Yeah.
You
Yeah.
know, especially in the field that I am specializing right now, which is cancer. You know
Mhm.
what I mean? Because when I hear some female testimonies, because most people I've interviewed, probably 90% is female, and that had cancer, you know, and they share their experience. Even a person that you spoke with, mentioned earlier on, Casey, she's struggling now with breast cancer as well, so for the second time around. And it was her experience why I've certain knowledge where, you know, sleeping as well and stress as well, that, you know, contribute to these factors. So, and you know, what you're doing, I really applaud you for you doing that, you know, reaching out to the community and sharing your knowledge and your experience so people can be aware. And that's my motive with this podcast as well, is to
Yeah.
reach out to the community, you know, share these experience, these testimonies to people so that people can understand this first-hand experience that a lot of people are experiencing. You understand? So I really applaud you to that. And you said he's in a better position now.
He's in a better position now because the thing is, particularly when it's young people, if they get the support early, the long-term prognosis is going to be better.
Right,
So that's evidence-based.
right,
Get the help early, get things put in place early, the
right,
long-term prognosis is much better.
right,
You know? And I have to give thanks. He's never had to really, you know, I think he's only ever been sectioned at one time.
right,
The rest of the time, he has had, you know, relapses over the years. But he, you know, we've managed to keep him out. One of the things, and I always loved this because I lived in Wolverhampton for a while. There was an organization there called the African Caribbean Community Initiative. They saved our bacon, they saved our life because they knew exactly how to, that was their specialism.
right.
That was their specialism. And I would say that to anybody that's listening here in the UK, if they're experiencing any sort of mental health or they want to support their loved ones, contact the African Caribbean Community Initiative because they will
Right,
give them lots of help and support as well. So
right,
I would say that.
right. One of the main thing on this topic that I really want you to address is
Yeah.
narcissistic.
Oh.
Narcissistic is classified as a mental health disorder. I never knew that it was actually a diagnosis. I just heard the word narcissistic. Start looking into narcissistic behavior. Start seeing certain pattern, and, you know, understand what is a narcissistic person. And you're doing coaching where females is concerned, with that struggle with mental health and abusive trauma and stuff like that. Can you walk us through some of that, please?
Okay. So talking about narcissism, and I think it's important to say that because it's now it's like a popular term. Everybody's talking about narcissists and narcissism. All of us are on the spectrum to some degree or other. All of us will have some narcissistic tendencies. Some of
Right,
us, so it's normal. Where you have the problem is where somebody has narcissistic personality disorder, and that's the difference. Okay, so we're talking about somebody who it is part of the mental. It's on the American Psychiatric Diagnosis of Mental Health Disorders, the
right,
DSM, and it is classified, it comes under what you call cluster B mental health conditions. And so it's up there with things like bipolar, what's the other one? Bipolar, borderline personality disorder. So it's up there with those things. The difference that I would say with narcissistic personality disorder, with the others, usually when somebody's in crisis, they can't help it because that's the nature of the condition. With narcissistic personality disorder, they know exactly what they're doing. They know exactly, yeah. There is no kind of, oh, my brain told me I didn't know what I was doing. There's none of that. Everything that a narcissist that is, you know, who has narcissistic personality disorder, they are a narcissist. They're very intentional about what they do. It's intentional. Yeah.
Right.
So they there are sort of traits that they carry. There's usually 9 according to the, you know, the manual that I just told you about, the American Psychiatric Manual. There are 9 traits that, and I can't remember them all off the top of my head right now, but there's 9 of them, and it'll be things like they're very self-absorbed. They are, they have ideas of grandeur. They, you know, they think that they're all of that. They are selfish, they're envious, they lack empathy, so they're not capable of being sympathetic or, you know, real sympathy or empathy with somebody. What else can I say? There's a whole list of them. They're very entitled, you know, and they think they're special, you know, so the 9 criteria that they have in this manual, they only need 5 to get a diagnosis of narcissistic personality disorder. So it's 5, okay? Yeah, so it's quite it's not great if you are in a relationship with a narcissist, because what happens is, and I'm speaking from a romantic perspective, because that's the other thing, it sits under the umbrella of domestic abuse.
Right.
But it's almost like a sub abuse, if you like, because domestic abuse happens within the household. It's within a intimate relationship. Narcissistic abuse can happen anywhere. It's not just in the romantic relationship. It can happen in the workplace. It could be your friend that's a narcissist. It could be your boss, your colleague. So it's broader. You can find narcissists anywhere, and that kind of differentiates it from what we would traditionally call domestic abuse. It is still abuse, nevertheless, but it sits under that. More often than not, a narcissist is not necessarily going to be physically. They can do. That's not to say that they don't. They can, but the abuse is more emotional and mental. And a lot of them are smart enough not to bruise up anybody, because their image is everything to them. So they have to maintain this false persona, and that's how they get people entrapped into relationships in the first place. So there is such a thing as the narcissistic cycle of abuse. So what happens is, when they meet somebody, the likelihood is that they've already studied this person. They've already decided, this is going to be my target. They've probably already searched up your social media, found out all kinds of things about you before they actually approach you. What they'll do is they'll be very charming. They will treat you, they will already know you, at least some aspects of you. And they will ask you questions to, you know, to kind of consolidate that for them. They will mirror you. So for example, and when I talk about mirroring, what they will then do is, for example, let's say you went out to dinner and you're having a conversation, and they ask you, oh, what kind of music do you like? And you say, I don't know, let's say Luciano or something like that. Oh my goodness, I love Luciano as well. You know, and they'll say, which one is your favorite tune? And then you'll tell them, and then they'll go, yes, that's mine as well. And then, you know, they'll chat around that, and you think, wow, this person is
compatible.
Oh my goodness. You think, yeah, man, this person really, I've never met anybody quite like this person. They really get me. They really understand me.
Right.
And you think you've met your soulmate.
Right.
You think you've met your soulmate. And what will happen is, the people around you, they'll be really charming to them, and everybody will be thinking, wow, you've got a nice man here, or you've got a nice woman, because women can be narcissists as well.
I say women can also
women, yeah, absolutely. There's no I mean, it just so happens that I work with women.
Yeah.
I have, but I work primarily with women.
Right.
Men, but men can be abused as well, and are being abused. I've had 2 male clients,
right,
even though I primarily work with women.
Right.
And if I'm honest, they've had a very bad time, these guys. Probably more so. I mean, it's bad. Yeah.
So they've been affected by their partner who is a narcissist.
Yeah, absolutely. So men can suffer too. And what I would say as well is that for men, it's a lot harder. I had a client, or I know of a client, actually, it wasn't mine. It was, he went to the police. They laughed him out of town, told him to go home. And this is the thing. It needs to be taken seriously, because this is not a joke. It's not a joke. They will hurt people emotionally. So I was talking about the idealizations, or the love bombing. Another word for that is love bombing.
Right.
So they give you gifts. They meet your family and your friends, and everybody thinks that they are wonderful. Wow, you've got a really nice guy there, or a really nice woman there.
Right.
So that's that. And so it usually happens very quickly. So when you meet a narcissist and they take set on you, they will lock you into a relationship. Within 3 months, you are in a committed relationship with this person. They will tell you how much they love you very early on in the relationship, and that actually is a red flag. So you need to be careful. The mirroring is a red flag.
That is the next thing. Like,
yeah,
I've been in a situation where I'm speaking to a female, not even 3 months, and oh, I love you. Like, how can you love me? What do you know about me?
Right. Yeah.
What do you know about me? Why do you love me? How you know that you love me? Like, what reason you have to love me? Like, we just know each other.
Yeah.
Right? So it's like, but what are some of the things that can happen into a narcissistic relationship?
Right. So I've just explained about the love bombing, or the idealization. So this is a cycle. And that's how you know it's a disorder, because every narcissist will do this. Every narcissist. You ask anybody and they will say, oh yeah. So you had the idealization, or the love bombing. So they'll give you gifts. They make out like they love you so much. They put you on a pedestal, and you think, wow, I've met my soulmate. It happens really quickly. They will, they will future fake. So what they call future faking. So they'll say things like, let's get married, and they'll even engage you and all of that, knowing fully well that that's not what they're not going to go through with it. Some of them will, but that's what they will do. They'll future fake a future that you think is, wow, yeah. Once you are locked in to this relationship, the cycle then moves into the next phase, which is the devaluation.
Right.
So everything that they loved about you in the beginning is suddenly something to be hated. So for example, I'll give you an example. So let's say you had your hair short, really short.
Right.
They loved that about you. Right. Now in the devaluation stages, you look like a man. Why don't you just grow your hair? Women shouldn't have their hair short. Just grow your hair, And it's like,
so they're putting you down at the same time as well.
Right. So it's a put down. And that's what they do. So, and sometimes it'll be subtle. They'll start to put you down, and you're kind of second guessing yourself, thinking, what's happened? Now you now think it's your fault that this is happening.
Right.
because everything was all right. So you're thinking it must be something that I've done. So now you are now trying to get back to that place where everything was wonderful. So you start to move your own boundaries. You start to move your own, goalposts to kind
Right.
of get back to where things were nice.
Right.
So you'll do all of those things, and you'll be second, and then they will gaslight you. So they will say things to you. They'll say something, and then when you question it, I never said that, and then now you're thinking, what's going on? So you're now confused.
Right.
So they will do things like that. They will lie. They will cheat. They will do all of those things. They will triangulate you with other people. So, for example, if there's another, they might have somebody on the back burner they'll bring into the relationship and triangulate you all. You know. So they will do all of that, and this is all part and parcel of the devaluation. Make you feel like somehow you're not good enough anymore.
Right.
And you're now thinking it's you. You're now becoming depressed. You're now thinking, your self-esteem is gone. You're thinking you're feeling very unworthy, humiliated and shamed, all of those things. And then it moves into the third stage, which is the discard. So that's the term that, is used a lot. So that's when they'll just get rid of you. They'll just leave you. And they might physically do that or physically leave you in the relationship. They just disconnect, from you. And it's like, what happened? And it will just come out of the blue. Sometimes you don't expect it. Sometimes you think things are all right, and all of a sudden they've gone, and you're thinking, they've ended it or whatever, and you're thinking, what have I done? And now you are now, well, what happened? And you're trying to talk to that person because they don't give you closure. They won't tell you why necessarily, but they don't give you enough information to say, okay, I'll move on. They leave it so that there's a door for them to come back.
Right.
Because that discard is not permanent. That discard, when you think that they've ended the relationship or whatever, no, they haven't. They just put you on the shelf.
Right.
While they go off and do whatever it is they're doing, and they will circle
and then
back.
come back.
They will come back.
Oh my days.
They will come back.
Oh my days.
Yeah. And so the next part of the cycle is when they come back, and that's called the hoover. So they will hoover you back in.
Oh, right.
So it might be that they'll ring you and say, I'm sorry, or they might get in touch with your friends or whatever, and people around you. So they will make the people around you think, oh, just give him a next chance, or give her another chance. Or and so they'll use other people. If they can't get to you, they'll use other people to kind of get back in. And that's the hoover. So they'll come back in and tell you that they're sorry and all of that. And then you start again. And then the cycle just continues. But each time the cycle goes round, the time when they're nice, when everything is good, becomes shorter and shorter.
Oh.
And you're just in this cycle of abuse all the time.
So would they pretend like not yet, like say they have an argument and they say let's say they're not living together. They have an argument on the phone or physical in appearance. They left overnight and they come back in the morning and pretend as if nothing ever happened.
Absolutely.
Oh my
They will do that. Yeah. Yeah.
Oh my
So it's like reset time. Reset. We'll just reset and carry on. Yeah.
Like nothing never happened.
Like they won't
we never had an argument last night.
Right. They won't address.
They won't address what happened.
They will not address it.
Oh my God.
And if you try and address it, you are now the troublemaker. You are now, you're now the one that's the problem.
Right.
And so this is the cycle that continues. Yeah. And the only way to break that cycle is if you break that cycle.
Right.
Only you can do that, because they will continue with it. They will continue with it. And even if they have discarded, they could discard for a week. They could discard for a few months, even years.
Yeah.
And they will still come back round. That's what happened with me. 15 years, circle back round.
So you was into a narcissistic relationship before?
And then we split. 15 years later, And I had no clue that that's what he was. So the very first time when we split, I was devastated. I mean, I can't even tell you how a broken woman I was the first time round. And it took me almost 10 years just to find myself again. I mean, I was totally destroyed, totally. And then 15 years later, when I'm feeling like, oh, you know what? I'm living my life. I'm, really successful in my profession, doing what I'm doing. This man just rocked up again.
Boom, just like that.
Yeah.
Pop up.
Yeah, it popped up. I had no intention of getting into a relationship with him. That wasn't my intention. But before I knew it,
you was back in a relationship.
I was back in a relationship and I was thinking, how have I got here? And again, it's the love bombing. They go through the same cycle, And part of me, because I didn't know, part of me was like, well, it's 15 years. I didn't know what I was dealing with anyway. People change and he seems a lot more mature now. And that's how it was. It was very different from the person 15 years ago. So I thought everything was cool, but clearly it wasn't. It just meant he had 15 years to really hone his skills as a narcissist and really come back now to cause as much damage. But there was a part of me that probably didn't give him everything like I did the first time. So there was a little bit that I held back. And it's funny because when you're in a relationship with these people, something tells you that something isn't quite right, but you just can't put your finger on it. I don't know if anybody else has been in those kind of relationships where there's nothing necessarily, because right early on in the beginning, it all seemed really nice, but there was just something in my gut just saying, And I remember one time, because he lived in another country as well, so we would FaceTime all the time, and we had a wonderful conversation. At the end of that, as I'm getting myself ready to go to work or whatever it was I was doing, this thought came into my head, which was, you need to leave.
Right.
And I remember thinking, oh, Marcia, why are you even thinking that? Nothing's happened. But it was like spirit was telling me, you need to leave, but but what happens is we override the red flags. If we think about it, there will always be something that was an indicator that something wasn't quite right. We
ignore it.
We ignore it. You can't put your finger on it and you ignore it to our detriment, and so the only way that we can free ourselves, really, and not everybody can do this, we have to be the ones to bring the closure, because they will never give you closure.
Right.
They will not give you closure. That's something they cannot do. You have to remember that narcissists are unable to form lasting relations. They cannot be in a committed relationship for long.
Really?
They can't be. That's why they keep having all these relationships. They cannot be in, they don't have the empathy. Remember I said those list of things.
Right.
And one of them is lack of empathy. They don't feel in the same way that we would. Like, for example, if you're dating somebody, you break up, painful as it is, you might, from a female perspective, it's painful. You might cry a bit, eat ice cream or chocolate for a little while, and then you're good. You might even still be friends with the ex, and you can still, you can still vibes with that person. A narcissist, you can't.
Right.
That's not going to happen, because they'll always want to continue that cycle of abuse. Okay. Right. And when it happens, when you get the discard, people want closure. Why did this happen? They need to understand, but the only closure you're going to get is the closure that you give yourself.
Right.
And that means absolutely no contact. That's the only way you're going to get rid of them. Some people get pestered for years. Some people get stalked, because once you discard, if you then choose to not go back, be prepared for those things that might happen, because they will try.
Right.
Yeah. Might not be straight away for some people, but they will. And they will watch you from a distance. When you think they're not happening, or they're not bothering, trust me, they'll be watching your Facebook or your social media things, and they'll be watching to see what's going on, to see how broken you are.
So them is a stalker, secret stalker.
Yeah.
I was watching a podcast with this doctor, narcissistic doctor. I think her name is Dr. Ramani.
Yes. Yeah.
Right. And she gave us some advice as how to, react or to deal with a narcissistic person. And one of the things that she said was just agree with them. Just say, okay. Don't enter into an argument with a narcissistic person.
You're not going to win it. So might as well you just keep done the argument
Right.
because, don't even, yeah. She's
So when you're in a relationship, as you said, narcissistic is an a diagnosis.
Mhm.
Do many people know that or would accept that they're a narcissist? No.
No. I think in this country, I think it's between 4 and 5%. In the UK, between 4 and 5% of the whole population have a diagnosis, a clinical diagnosis of narcissistic personality disorder. And when you check the statistics, the reason they got the diagnosis was they were either in prison,
Mm-hmm.
they were either, in the army or something like that. They are not going to volunteer themselves to be tested because it's like, who, me? Nothing is wrong with me. They're not going to volunteer
Why
themselves.
me need for go to that test there?
Right. They're not going to do it. No.
Right. Right.
Yeah.
Marcia, it was like we could go on and
We could.
on. Like there's so much that I would like to cover, but with the essence of time, we have to leave. And but we really do appreciate you taking the time out to give us these insightful message about narcissistic and mental health and the whole thing. And your real life story with your son really is really a testimony. And thank you for the work that you're doing. On this podcast, we have a closing tradition where the guests leave an encouraging word for the next guest coming up. And you're this person that left the encouraging word for you, not knowing who will be coming up. It's Moni Morton. Where is it? And she said, find who you are and do it on purpose.
Love
Right.
that.
So thank you again for joining with us on the Ivy Cancer podcast. And I'm giving you a next invitation to touch some of these topics that I have about some of the fields that you cover. So looking forward to speak to you again. You do have a wonderful week ahead. And you
Thank
take care of
you.
yourself
Too.
and
Thank you
keep doing the
so
good
much.
work.
Thank you. And you also.
Thank
I
you.
commend you for the work that you're doing also.
Appreciate it, man. All right. Take care.
Thank you. Bye-bye.